Hi, my name is Dr. Akshay. I am a consultant neurosurgeon and spine surgeon at Aster CMI Hospital, Hebbal, Bangalore. What do people like Usain Bolt, Elizabeth Taylor, Kurt Cobain have in common? Well, they have all had scoliosis. Approximately 5 to 7% of people in the world are affected by this condition. Every year, the month of June is celebrated as the Scoliosis Awareness Month. And the last Saturday of the month is observed as International Scoliosis Awareness Day. The aim is to create awareness about this condition by public education and also to bring together those affected by it. Scoliosis actually comes from a Greek word which means curvature. Scoliosis is a complex spinal deformity. Simply put, it refers to an abnormal curvature in the spine where it starts bending to either the right or the left, forming a C or an S-shaped curve. According to the Scoliosis Research Society, typically any lateral curvature of the spine that deviates for more than 10 degrees is considered to be scoliosis. Scoliosis can usually be seen affecting children from newborns to teenagers and sometimes even in adults. Different types of scoliosis may develop at different age groups. In children born with scoliosis or those developing the condition at an early age that is below 10 years, it is known as early onset scoliosis. More commonly, scoliosis is seen in teenagers between 10 to 17 years of age, and this is called adolescent idiopathic scoliosis or AIS. Idiopathic scoliosis can occur in both girls and boys. However, girls are more at risk of developing their curves increase in size as they grow. Scoliosis involves rotation of the vertebral bones, and along with it, the structures attached to the spine may also become deformed. Parents of children with scoliosis usually note one or more changes such as unevenness of the waist, one hip higher than the other, one shoulder higher than the other, one shoulder blade becoming more prominent, the chest shifting to one side, or an unevenness of the front of the chest. There may also be an abnormal projection of the ribs on one side called a rib hump. Adolescents with scoliosis may not feel any pain initially at all, though in advanced situations there may be a significant cosmetic deformity leading to psychological trauma and even depression. In some cases, due to changes in the chest shape, the lungs may get compressed, resulting in reduced respiratory capacity with breathing difficulty. This usually happens in advanced cases of scoliosis. Scoliosis, we have to understand, is a progressive disease. The good news is that most patients can be treated in the initial stages without surgery using a combination of observation, preventive exercise therapy, and in some cases, spinal bracing. Any spinal curvature can get worse, especially during a teenager's growth spurt. It is this time when parents need to watch teenagers very closely and be proactive with their care. Screening programs in schools could be an effective measure to trace these diseases in children. As most teenagers with AIS do not have much pain, they can be expected to live a full normal quality of life. Only about 1 in 1,000 teenagers end up having a scoliosis that actually gets worse to the point where surgery is necessary. The goal of surgery is to straighten the spine and prevent further progression of the scoliosis. Surgery involves instrumentation to correct and derotate the spine back to a more normal alignment. Most teenagers who need surgery do exceptionally well and get back to their full life without pain once they are treated.